Good evening, ladies and gentlemen. Thanks for watching us on the Healthy Life shows. I'm Dr. ANOUD JUWAIHEL, a family physician. I'll be happy today to carry on the show with you. And this is my colleague.
I'm Dr. NOOR NEBARI. Welcome back. I hope everybody had a really good weekend. Today we have a very special guest with a really interesting topic, and of course we're going to talk about a lot of things about diabetes as well, and the diet during Ramadan. If you have any questions during the show, just contact us on the following numbers or mention us on Twitter as well. And here are the numbers.
Welcome back, viewers. Today I'm going to talk a little bit about interesting topics, and then we're going to have a couple of conferences which is going on here in Dasman. My topic today for the show is about insomnia, and as you know, the word insomnia means trouble sleeping, and this is actually a very distressing situation for a lot of patients that I encountered in my own clinic. So I have a little bit views about the causes of the insomnias and how do you treat it. Mm-hmm. You know, like insomnia could not really means a troubling, like, you know, I mean, like the definition of insomnia is trouble sleeping, and the trouble of the sleeping would be sometimes initially at the beginning of the sleep, or sometimes during sleep, in the middle of the deep sleep, or at the end of the sleep, where the people usually wake up really kind of early in the morning.
Yeah.
And the causes of insomnia, when a patient comes to you or is complaining of sleeping disturbance, they should actually, we should actually ask a lot of questions to get the reason. And once we found the reason for insomnia, then we probably can help the patient to solve it out. One of the most common causes of insomnia is actually our jobs. So if we have, jet lags or, shift works for us as a doctors, that could be
it's a disaster.
It is
It's a disaster for sleeping.
And this is actually a disaster for a pilot, because they keep on coming from long trips, and, they experience a lot of jet lags and so on. So this could be a huge
I think they're used to it, because they love their jobs. That's what I think.
Well, yeah, but they will have trouble sleeping, I would say.
I think moms, any mom
has that's the biggest trouble, I would say.
If you're a mom, then you're definitely
that's a
having
huge
insomnia.
job. Yeah, that's a 24 hours.
So it's a 24-hour job.
24/7, I would say. And the other pathological problem that could be related to insomnia would have been some medical illnesses. Some people who are heavy smoker, they would have something like chronic bronchitis or something we call COPD. They will be coughing at night a lot. And people with asthma or uncontrolled asthma, they would definitely be coughing at nighttime, and that will definitely disturb their sleep habit. And some people, they have some kind of, chronic pain for, like rheumatoid pain or osteoarthritic pains. And
exactly.
they would be suffering.
Basically, anything that causes discomfort for someone is actually going to cause some sleep disturbance.
Yeah.
And I think the biggest issue now in our hectic lifestyles, and as working mothers and working fathers, it's just, I think it's stressful.
I would say so. Anxiety and depression would be other psychological cause of insomnia.
Yeah.
So doctors should really, search for any, symptoms that lead to depression or anxiety that could be associated with insomnia. So as I said, there is a lot of causes of insomnia, and as you can see, if the patient have any trouble during sleeping, times, then they would have a lot of physical symptoms.
Yeah, they will.
They will definitely feel very hectic, very tired most of the times.
Yeah, and you will go to bed
Bad mood.
immediately, and just, you know, the snooze button is always
Yeah,
working.
exactly.
Yeah.
So, you know, their concentration will be going really down, their even immune systems function.
Yeah, it will reduce definitely
Exactly.
your immune system. It will be poor functioning.
So they were prone to a lot of infections, a lot, especially, you know, flu symptoms. And it will bring out their blood pressure high, so it could be a risk factor for high blood pressure and obesity. So if you're sleeping well, we wouldn't be at high risk of gaining a lot of weight, I would say.
Yeah.
So sleep a lot.
Yeah, unless it's the weekend, then you have to stay up late for the movie night.
So there is a couple of tips, you know, I would
Yeah.
say, that we can give to our patients in order to help them to improve their sleep pattern. And this is actually called the sleep hygiene. So
Yeah.
the best thing is actually to establish a regular waking time and actually sleeping time, and to, you know, limit their sleeping hours. So for example, to make a fixed time, like I will sleep from 10 and I will wake up at 6 o'clock. So that would actually help the patient a lot. And exercising before sleep more than 2 hours would actually help the patient, because it will, you know.
You mean exercising for 2 hours, or?
No. I mean, you should exercise, but they make the period, you know, before they sleep, roughly 2
They
hours.
should, yeah, they
so
should exercise
got-
2 hours before bedtime.
Yeah,
Okay.
so that would be very, very effective to make you sleepy. And actually, to make the bedroom actually purely for sleep, I mean, not to, you know, bring a lot of food or, you know, applying TVs or, you know, movies at room times.
I don't know,
sleep
but
times.
it really helps me sleep.
Really?
I
That's
don't
what
know
they
about
say.
you, but they
So-
do.
And apparently, caffeine, avoiding caffeine, especially at night time, would be, I would say, effective, especially if people are
yeah,
using.
I guess so. It's very effective. Just
Yeah.
you limit your caffeine in the morning and just drink something herbal at night, like mint, or eat, you know, some lettuce maybe.
Okay,
Did you hear about that?
the lettuce.
Lettuce. If you eat
Okay.
lettuce, you will sleep
Okay.
so much better.
So that's a very light, dinner meal you make it. And actually, what is it about relaxation? I mean,
Yeah.
try to relax at night times and try to, you know, take a hot shower or
Yeah.
listen to relaxing music or jazz. That would actually smoothen your mood and probably help you to sleep.
Absolutely. Yeah.
So these are a couple of tips that I have for you here to help you with regard to sleep. But if it doesn't work, you have to see your family physician in order to look exactly to what is the cause of your sleep disorders,
Yeah.
and probably
Always.
help you with
Mhm.
some medication that could
Exactly.
help your situations.
Like, always visit your doctor. If you're having trouble sleeping, it might be something that is not just stress, it might be something more. So
Physical.
always, yeah,
I would say so.
get advice from your doctor.
Okay.
Now we have a report about Dasman, and we will have a look, but don't go away. We will be right back.
I'm a registered dietitian from Dasman Diabetes Institute, and today I'm going to be talking about healthy lunch boxes. Kids spend approximately 8 hours a day in school, which constitutes a third of their day, and they perform various activities, activities that stimulate their minds, activities that stimulate their bodies. In order for them to have enough energy to last with them throughout the day, they need to be properly nourished. Now, canteens these days don't usually supply healthy foods. They usually have snack foods, which are popular with kids, like potato chips, chocolates, juices, and sodas. And so sending your kid away to school with a healthy lunchbox is a good idea and a good start in promoting a healthy living for your child. A common lunchbox item is just the good old sandwich. You can put in different fillings. Make sure you put in a filling that your kid likes. For example, if your kid doesn't like tuna, then don't put in tuna, because you want them to have something that they'll eat, not something they'll throw away when they go to school. A lot of kids like turkey because it's mild. It doesn't have like a strong flavor. So you can put that in. You can add honey mustard or different like dressing. Some people add like a bit of balsamic vinegar to give a bit of tanginess. Something else that you can add like as a snack or something that they can eat with the sandwich as opposed to potato chips, just plain old carrots. You can put in dips like pesto or something if you want them to add like a bit more flavor. You can also use celery. That's another healthy option, or cucumbers if your kids like cucumbers. And you can just pack them in easily. Some kids don't like them to be in bags because once that you put them in their backpack, they tend to get squished. So you can use like these containers and just put in their sandwich with, I guess, the side, like carrots or, as I said, celery or something else like that. And just pack it and put it in their backpack for them to eat. Another option other than turkey would be labna. A lot of kids like it. You can add in a bit of vegetables, just cucumbers or tomatoes. If your kids will accept it, just a bit of mint leaves, which gives them a lot of vitamins and minerals. Another thing that kids tend to like, if they're not allergic to nuts, peanut butter. Add a bit of honey for sweetness, or bananas. So that's another option you can use. And some parents don't think peanut butter is healthy or it's fatty. Actually, it has a lot of monounsaturated fats, which are really healthy and are good for kids. And they help them feel satiated, so they won't feel hungry after an hour. Okay, another thing that you can add instead of chocolate or potato chips, just nuts, which also provide them with poly and monounsaturated fats, which are healthy fats that promote, that are good for the brain because they help renew the cells. Also, they have a lot of calories, so your kids will stay full for a while, and they won't crave things like chips or chocolate. Another thing that you can add, just plain old dried fruits, because they're sweet, so they can satisfy a sweet tooth. Also, just plain old fruits, bananas, apples, whatever fruit is in season is even better because it has more vitamins and minerals. And a lot of kids tend to like juice. I'd stick away from juice because it has a lot of sugar and tends to contribute to the bouts of hyperactivity that kids get during the classroom, so it'll decrease their concentration. So I'd go with milk, which gives them calcium, protein, vitamin D for strong, healthy bones and teeth. If they don't like milk, then just go with yogurt or liban if your kids like it. And also, kids run around all day, so they lose a lot of water through sweats and breathing. So just make sure you add in a water bottle so that they stay hydrated throughout the day. And make sure you eat your vegetables and exercise often. Thank you.
Welcome back, dear viewers. Now we're going to move on to the most important part of the show. We're going to have a meeting with an interesting guest here to talk to us about diabetic food. Since you know that the diabetes is becoming really highly, rating high actually in Kuwait.
Exactly, it's a really, it's very common in Kuwait, yeah. And almost every family have diabetic members, and it's. So today we have a very special guest with us.
Yeah, so this is why actually we have invited Dr. Ghanem Al-Hjailan, a medical consultant and consultant in infectious disease hospital. Thanks for accepting our invitation, Dr. Ghanem.
And thank you for inviting me.
Thanks.
It's a pleasure here.
Thanks a lot. Dr. Ghanem, as I said, like diabetes actually become really very prominent disorders or chronic disease in Kuwait, and as we can see, there is a huge increase in the numbers of the complications we see. This is why we donate this show, especially for a major complication, which is purely in the food.
Yes.
So today our show is going to be purely about diabetic food.
Yes.
So can you tell us a little bit more about diabetic food? Okay. What is it and what does it specialize
first,
for?
let me go back on how huge is the problem in Kuwait. We have statistics here saying that about 25% of the population in Kuwait, I'm not meaning Kuwaitis, it's everybody here in Kuwait, are having diabetes. And there are many complications of diabetes, starting from the eyes, loss of vision, which is the most common cause of loss of vision worldwide. And then down to the foot, going through the kidneys and losing your the kidney, and and losing the feet. I'm very interested in dealing with diabetic foot. Now, what is meant by diabetic foot? We're getting a lot of patients coming. There are many definitions, but the basic thing is an infection in a patient who is non-diabetic, and this infection will be below the malleolus, which is the bone sticking at the side of the foot. Above it, it is not my, it doesn't go in the definition.
Okay.
Okay, so that was the definition. Yeah.
So diabetic foot is it common, like with
Yes.
diabetic patients?
It is. It is estimated to about 15% of all diabetic patients during their life they will experience this, and, and about 5% of patients they will have some sort of a problem related to diabetic problem, and this problem is actually, it's a range. It is something from something trivial like some redness in the foot up to something serious, which is an infection, can be even a life-threatening infection. And we do see these extremes of presentation.
Why there is some people who are truly diabetic suffer from diabetic foot, and others don't have actually experienced any problem with their foot?
Actually, it is related to how long you have diabetic. If you have it for a longer time, there you have the chance of developing it. If you don't have a good control of your diabetes, it will, the time needed to have this problem will be shortened. If a smoker, hypertension, if somebody having peripheral vascular disease, meaning the narrowing of the blood vessel supplying the feet, even not taking the advice of using a proper shoes, and taking care of the nails and cutting them in a good way, and taking care of the feet. So this is why people develop it at different stages than the others. We do see them in people who have good care, see them at later age. But I'm seeing at younger ages, I can see like 30 years old having this problem. So it is the major thing actually depends on the patient care about his health.
So it's the thing is about it scares a lot of patients now.
Yes.
So why is it so serious?
Actually, the seriousness is actually, studies say that if a patient develop a diabetic problem, like an ulcer, 85% will precede the amputation, cutting a part of the foot. Having an amputation will really affect the person's mobility, and at the end he will not be able to lose the weight by his mobility, and diabetes will get complicated. And the other studies that say that if a person have an amputation, loss of his foot, about mortality, that's increase of death, about 30% of them, they are prone to have an earlier death, which is related to ischemic heart disease. This is why it's so serious.
It's very serious. And the thing is, it's a very simple wound that can occur, and often diabetics don't feel the wounds. Is that right? So the thing is, it's simple wounds that causes that. So what kind, is it like bacteria that causes this kind of infection?
Yeah, what happened regarding the wound itself, I've seen patients coming with a history of having this wound for about 3-4 months, and all the dead tissue inside, and the bacteria just enjoying this environment. And by saying that, there is a moisture and there is a good amount of sugar coming to the wound, so the bacteria can grow nicely in it. Regarding the type of bacteria, usually it is the normal skin bacteria, and we can name of 2 of them, Staphylococcus, which is normal one that causes skin infection, and the one who's more serious of Streptococcus would usually have a faster inflammation. So these are the 2 things. But if the patient is exposed to antibiotics, other antibiotics, usually they can come with a different set of bacteria. We call them like the gram-negative, like Pseudomonas and Klebsiella, and this will alter the management which way I should deal with the patient, if he was exposed to antibiotic or not, and we'll decide which antibiotics I should use in, during this management of this case.
Dr. Ghanem, physiologically, could you explain for the patients how does poor control of diabetes affect the lower foot? I mean, could it affect the vascular supply or the nerves? How do you respond to that?
It is the chronic effect of the diabetes. Now, the first thing, patient doesn't feel pain. So they can walk in small nails, and they even can have them small stones in their shoes. They don't feel the pain. And then the damage will happen. Then blood supply is very important in helping healing the wound. It's actually affected. They have, what I mentioned before, peripheral vascular disease. The blood doesn't really reach in a good amount to heal. Looking at cellular level, the white blood cells that are concerned with the dealing with infection, the high sugar in the blood actually affect their function. They don't work as normal. And even the high blood sugar in the blood, it will deposit in the cellular matrix that's needed to build the material for healing. So everything has been changed from blood supply, which is called the macro environment, to something small like a micro environment. And so it is actually a complex of things that leads to this problem.
So the thing is with diabetic foot is just that the patient is usually, as I said, he doesn't feel it. So what is the best way for the patient to prevent this problem from happening?
So it is a preventable problem. Patient should have a daily check on his feet. If he could not, he can ask his relative to have a look. Usually, once it started, we call it an acute wound. Dealing with an acute wound is much different from dealing with a chronic wound, which is the definition of more than 4 weeks with the patient having this wound. The healing is much faster for acute wound and doesn't need that much effort. And it's good advice for the patient from the beginning.
Yeah, so if they catch it quickly,
yes,
it's better for them.
But if you come late, actually the way of management is different, because they look at the cellular level. If you do something called histopathology, this is the total different population of cells that from an acute to a chronic, totally different. Actually, sometimes, and the only way of dealing it is actually to cut the old wound, to change it from a chronic wound to an acute wound. But the patient doesn't, most of them find it, how come I just came with a small wound and they just left me with a bigger one. But the bigger one is called acute, and they tend to cure much faster than the chronic one.
Yeah.
If, Dr. Ghanem, if the patient lose the sensory supply to their legs, I think they will be prone to a lot of bone destruction.
Yes.
Could that happen in diabetic patients?
Yes, we get it called charcot foot.
Yes.
Which is usually the foot is like a beautiful arch. Due to the stress, the patient doesn't feel pain, changes of blood supply, it just collapse, become a flat. Then they are part of the foot that the bone sticks in it, and they are not protected by a fat pad. You actually can see with the time the patient bone goes through the skin, and it comes like I don't have the picture of it, but you can see from his foot there is bone sticking out and causing the destruction of the skin.
Yeah, and the thing is, with those changes, so are there other complications that diabetic can have in his foot?
Regarding the foot?
Yes, the foot. Are there other complications
there are
with the foot?
other complications. It's not only having wounds in it. One of the interesting one is the nails change. The nails, they get fungal infections, and that will lead to an amazingly thick nails. It's difficult to deal with, and trying to cut it. I've seen many patients coming with the thick nails. They couldn't find a tool to cut it, And once it gets larger, it starts, affecting the skin around it, and it can cause something called ingrowing toenail.
Yeah, it's very
And,
painful.
it is, yeah, it is.
It's a painful situation.
And there is another thing which is related to diabetes. We call the neuropathic pain. The patient will come and saying that I have pain that mainly comes in the night. I could not sleep out of it, and it is called neuropathic pain. It is not diabetic foot problem. It is something expected that to happen, and the way of dealing with it is different than giving managing the foot itself. We're giving some other medication to control this pain.
Dr. Ghanem, there is a lot of, some patient, I would say, can reach a very serious stage in diabetic foods, especially gangrene. So can you tell us exactly what is gangrene and why do people reach this stage?
Gangrene is a scary name.
It's a scary thing, I
Very
would say.
Everybody, I think, have heard about it. It's gangrene is mean that there is a serious infection of dead tissue, and the bacteria is at that level is the winner. No antibiotics will do. The only ways to deal with it is to cut that affected part.
The affected part.
And because all this is just dead tissue, and I can demonstrate that to the patient actually. They get scared. We cut the part of the dead tissue, and there is no pain, no blood coming out, and the only thing is the bad smell coming out of it. And if it's small, we can deal with it, but if it is taking a significant part of the foot, then we need the surgeon to deal with it. Actually, the cutting should go through a healthy tissue. You cannot, and there is no way of taking part of the necrotic tissue, the gangrene, because if you incorporate it, put it in the wound of the cut, it will just grow, and it will grow. You have to cut it at a certain level to make sure that it doesn't spread. And this is, the patient don't really, they feel that to have like a quarter of the foot, why you are taking half of my foot? No, it should be done that way.
Yeah, yeah. Well, I think it's even very devastating for the patients because this is actually will interfere their lives in a very huge way.
Yes.
So does this cause any problems? Like, do patients refuse sometimes the amputation?
It is. They are justified to be scared of it because it is affecting their mobility. And imagine that the patient steps and walk will not be the same as before. And as I mentioned, usually it's an alert or a sign that there is increased chance of death. I've seen many patients, even a relative of mine. They start of having a diabetic foot problem. It's just about 3 to 5 years that the chance that they will die. And it is an unfortunate thing, but one have to talk about it.
Yeah, absolutely.
Dr. Ghanem, since we are talking about the food, we would like to mention a little bit of information about the pain the patient will experience in the lower limb, especially while during walking, especially if they have diabetes or hypertension. So what is your response to that?
Okay, if the patient is experiencing pain during walking, this is a very important thing to look at the blood supply. This can call something we call it ischemic pain. And it's very characteristic that the patient working like a certain distance, like 100 meters or so, then the patient will feel the pain in the cuff.
Okay.
And if he stand or sit for a few seconds, it will go. This is very characteristic, and he should seek medical attention as early as possible. And the chance that he will be seeing a vascular surgeon, and before that, a vascular study should be done. I've seen one patient who have suffered from this problem for 7 years, and at the end he was managed only for, they told him that he's having arthritic pain.
Okay.
And it just needed only for a doctor, just put his hand and feel the pulse. This is one thing. Regarding the other pain that comes in the night, this is called neuropathic pain. And there is many description of it, One is like feeling ants moving over your feet, or sharp pain, or burning pain. It's a group of description, but the thing that it's happening at a patient who is non-diabetic, who had it for many years, and usually comes in the night, and can cause insomnia for them.
It will cause lack of sleep, absolutely.
Yeah,
so we'll continue the talk after the break, so just stay with us and we'll be right back. Welcome back, dear viewers, and we will continue on our conversation about the diabetic foot. Now, the thing is with the diabetes or diabetic foots, it's the thing is, do we have specialized clinics or podiatrists to examine the foot?
In Kuwait, fortunately, we have many clinics dealing with this problem, and some of them are much better equipped and more enthusiastic in dealing. I can proudly say in Mubarak Hospital and in Amiri Hospital. They are very, very good in dealing with patients. They are well oriented. It is impressive and something to be proud of. The other hospitals, they have less than perfect. Actually, it is most of them having one room and one doctor to deal with a nurse who have a good experience. But they are actually an auxiliary service. If there is a problem with the patient, they will refer them to these major centers in Mubarak and in Amiri Hospital. I know that they are dealing with a huge number of patients in the morning.
Huge numbers,
About 70 in the morning and 70 in the afternoon.
That's
So about
plenty.
yeah, that's about one total
Crazy.
of 140 per each major care. Also, Dasman, we also there is a diabetic foot care, which is, I think it's at a much better level.
Of course, it's so advanced here.
I have the pleasure of working
everything.
with them for about 2 months, and I really enjoy it. And I hope that whoever have an interest, even being a doctor or a nurse, to seek some training here, which is, I believe me to say that I've been in the state, I have been conferences outside Kuwait, but this place is at the top level.
Wow.
That's very nice. Dr. Ghanem, is there any certain investigation that we could advise our patient to do in order to check if they have any vascular problem in their foot, or any
Yes.
neuropathic pain or
Usually,
neuropathic problem, I would say?
there are signs that can be noticed by the patient and his treating doctor. One of the good signs is at least from the male side, you can see hair loss. And you know that all the bandages of the skin, nails and hair are very sensitive to the blood supply. So we notice that, we know that as a doctor, that in the male they start losing the hair at their feet, which is one sign. The other sign is the dryness of the skin. And this is another sign. If you look at older people with diabetes, you can say them flaky, like powdery skin. Other sign is that they have very, very thin skin. They are paper thin. If you just have the time, just try to pinch the skin. It's so thin. Actually, if you a plaster stick there and try to take it off, you can take the skin
easily.
out. And this is one of the bad thing about people who didn't work enough with diabetic foot and trying to remove the bandages over the wound. Actually, they can rip off the skin, and this is a dangerous thing. The nail changes, as we mentioned before, indicate that there is bad blood supply. The nails will be brittle, thickened, deformed. These are the signs that without doing any investigation. Now the other part of the should be the doctor business here. He should feel the pulses. There are two sites, the posterior, the tibialis dorsalis and I forget the other one, sorry. Both should be checked for the blood, good pulses, and then we have the capillary filling, which is an easy thing. You just press on the skin of the toe and see it should be filling within 3 seconds. These are simple things you can do. Once you feel that something wrong with that, then it should be sent to a vascular lab. It is usually in Mubarak Hospital. There's a specialized unit of dealing with this these cases who have poor blood supply, and they can manage to have a bypass if it's needed.
So this is how a patient, examines his foot or investigates and other doctors. But what about at home? How do the patient examine their foot at home, and how frequent should they do it?
It should be done daily, and look for any wound or in foreign bodies. Even their shoes should be checked before being wear, and daily cleaning of the feet, and you put some moisturizer on the feet. Should be skin should be smooth, and if there is a callus, should be dealt with a proper way. Having a thick callus is not a good thing usually, because they break.
They break,
and when they break, there is a skin break, and they can be the start of an infection. Nails should be cut in a proper way. It should not follow the curvature of the nail. It should be cut straight. If you cut it in a curvature way, they will grow and cause what called ingrowing toenail. The shoes that the patient should wear, they should be wide and should not be tight shoes. It should be, and a person should, if he want to buy these shoes, actually should go at the evening to buy them, not in the morning time. Now,
why is that?
Because usually the feet, they grow in size by 1 or 2 measurement. So if you want to get the shoes in the morning and buy them, at the end of the day, they will be a very tight shoes, and they can cause problems.
No wonder most of my shoes don't fit.
So it's the evening time. Second thing, they should use a proper stocking. Should not be thick, and because if it's or loose, because if they are loose, they can have folds inside the shoes, and they can cause an unusual pressure area on the feet and start of an ulcer.
So what about between the toes?
Now the patient, as I mentioned, should clean and dry between the toes.
So the cleaning agent, what should they use?
Any soap.
Any soap. So they should wash it with soap at the beginning.
I don't encourage having certain soap, and even if you compare antibacterial soap with a regular one, really there is no much difference between them. Actually, the way of the soap dealing with the bacteria, actually it's mechanical. It's actually scrubbing them out.
Yeah.
It's not. They will not have enough deposition of bacteria to kill, and know that there is beautiful balance between the bacteria in our skin and the fungi. And we want them to have. If they kill bacteria, fungi will grow. Yeah, no, actually in fighting, and we just enjoy this fighting because there is a balance between them. Yeah. So if we kill the bacteria, the fungi will grow, and you have get the interdigit fungal infection, and that will cause the skin so fragile. Actually, if we separate the two and try to look at it, it can break the skin. The skin will be white with fungi. So if you just try to separate and look, you will open the skin, which is a dangerous action. And usually we send these patients to a dermatologist to give antifungi for them.
Doctor, why do some people, respond differently than others, especially during, treatment? Sometimes they take a longer time to respond to medications than others. Is there any difference?
Yes, know that each person is an individual with different things. So now, if I get a person who's very keen to listen to my advice, and he will not go walking around barefoot, and should wear a special. Now, if I have a patient with a wound in his foot, I will advise him to wear a special shoe to what call offloading. And this patient who follow this instruction, they tend to be better healers. But some of them, they don't actually neglect. They will smoke. They will not control their diabetes. But this is different. Unfortunately, this different exists. Some of them, they will not come regular for changing the dressing. So this is why some of them
respond better than others. Dr. Ghanem, we have actually a question coming up from our audience. His name is Abu Khalid. He says that what is this? How can they protect themselves during Hajj? Is there any specific vaccination specialized for diabetic patient for Hajj time?
Know that there is a group of people who call them high risk, and diabetic are one of them. We can also include ischemic heart disease, people who have heart problem, obese people, people who have respiratory problem. This group of people, they should be careful about taking the vaccination, knowing that the major problem in Hajj is an overcrowding of people, and there is a good chance of respiratory infections, like pneumococcal, now flu, and we have meningitis. And when they should take it at least 2 weeks before going to Hajj. I really hate it when a person go one day
before
and take this vaccine. There is no
immunity,
no benefit.
You
need at least a few days for your immune system to produce an effective antibodies to protect you.
Absolutely.
Yeah, so don't do it, please, before we go. Take 2 weeks, at least for your immune system. Also, hepatitis vaccine that we advise people to take. It should be at least 1 month before, because what happened? It is actually 1 month, the first initial vaccination, then the second one, which is a booster, then there is another one after 6 months.
This is for hepatitis B, is it?
Hepatitis B.
Yeah.
So there is no use of taking it just before you travel. The only thing you will do, you get pain and fever.
Okay.
And do not redo any.
So you always have to be prepared before. Now, what kind of vaccines would you give to these patients?
Actually, these vaccinations are actually called a dead part of the bacteria or virus. And,
is it like do you give anything like for the TB, or is it
no,
for...
No. TB is not part of the vaccination in Hajj. We vaccine for pneumococcal that can cause pneumonia or can cause meningitis. We vaccinate for influenza, which is a known thing. We vaccinate for hepatitis. These are the major ones that we deal with, and we give vaccination for Haemophilus influenza. It can cause also meningitis. So there is a group of vaccination that the patient, a person who's intending to go to Hajj, is to take them, because first to have a good, healthy pilgrim, and second thing actually not to bring anything back home. A person who has vaccinated, he will have a shorter duration of illness, and the likelihood of bringing something infectious back home is much less.
One of our viewers is Abu Abdullah. He's asking about what should a person do when they come back from Hajj? Should they go to the doctor directly, or should they take any vitamins or something like that?
The only thing that I know that we give something called an eradication, which is one pill of like ciprofloxacin.
So immediately when they
on their route coming back to Kuwait,
so
just one tablet. And this will remove mainly the Haemophilus influenza and Neisseria meningitis from their carriage. Know that if you get 100 person getting Neisseria, only 5% will have meningitis. So we want to get rid of all.
So 5% is actually significant.
Okay.
Now, back to our topic, which is diabetes. You know, Ramadan is coming, and I'm sure there's a lot of issues concerning diabetic patients and Ramadan. So can you tell us about that, please?
This is a classical question that I always raise at the beginning of Ramadan. There have been studies have been done here in Kuwait and other countries. Actually, there is no difference between glucose control in non-Ramadan and Ramadan times. The only thing that the patient should be careful about their food. I know there is a significant change in the type of food that will be provided.
And it's delicious food.
Yes, so still it is a commitment from the patient side to stick to a healthy food and to avoid these high sugar, high fat food, and there shouldn't be a problem. Now, thank God that most of our medication that we have, which actually can be given once or even twice, most of the patient. And a person who experience having hypoglycemia, Islam have allowed him to not to continue fasting, and he should follow the easiness in Islam, and he should not go and start to hurt himself and even cause a painful experience to his relatives.
Because it can be lethal. It can kill a person.
Is there certain people or a diabetic patient where you should tell them you should not try to fast at all?
Most of the patients.
Is there any certain criteria?
Most of the patients, they are usually well controlled, and they should, if they can do it, good. But somebody who's having something called brittle diabetes, which is difficult, he might need to take at least 3 injections per day. This person, I will advise him for his health is not to risk it. And there is other ways in Islam to enjoy this Ramadan by helping others.
Exactly.
So it should not really suffer.
Exactly. The thing is with the fasting as well is that patients, like you, as you said, they have hectic type of diet. So what do you advise do you have for the patients who have diabetes concerning their diet during fasting or breaking the fast?
Okay, because we are in the summer, patients should be good hydrated. You know that being a diabetic, they will lose a significant amount of fluids.
Absolutely.
Yes, they should be careful about their hydration. Regarding the food should have high fiber. That will decrease the amount of sugar absorbed. And you can use, if it's possible, to have fruits. They will have vitamins and low absorption and moderate absorption of sugar. Know that the sweetness of these fruits is of a complicated type of sugar. So they can enjoy the sweetness and still to not be as harmful as simple sugars like found in dates, which is one thing should the patient know. Dates have a good number of simple sugar, banana, and grapes. These are the three ones have simple sugar, which is not good for them. And of course, they have famous Game thing, which is actually it's an
It's a
explosion of sugar.
disaster for everybody.
They should avoid it,
So, yeah.
and avoid also the fat food.
Okay.
You know, the fat is a serious thing. It just increase their weight, and at some time it will make it very difficult to control their sugar.
We have also a couple of questions from our audience. There's one person called Abdul Wahab. He's interested to know what certain advice you would give a patient who's diabetic and he's going to Hajj, especially during their activities and during sun exposures and excessive walking, and how does it really affect their food and the storage of the medications and the insulin.
And the pilgrim, that I know that it's actually the most difficult part is maybe 2 or 3 days out of the pilgrim.
Yes.
And patient should have a good hydration, and should make sure that he should carry a glucometer with him if he felt any signs of hypoglycemia, and he should have some sugar with him.
Just in case.
Yes, because he don't want to have hypoglycemia in the middle of hundreds of thousands of people. Difficult for him to try to reach the medical service.
Yeah. Can you just clarify the symptoms of the hypoglycemia for the patients?
Most of the patients should be aware of it, but I will state it because it's very important. Now, the first sign, he will have sweatness. He starts sweating. He feel loss of energy. He might have fast heartbeats.
Yes.
And he can have blurring of the vision. These are signs that the patient should know that this can indicate hypoglycemia and also the feeling of hunger. These are very famous signs of hypoglycemia. And alhamdulillah, you have these glucometers, just small machines now. Just it will take about 20 seconds to know his reading that if he's having hypoglycemia or not. And it can be managed by some sweets can carry it.
Yes.
Okay, so it can be managed. The other thing that regarding the food, I think there is no problem of getting your regular meal during the Hajj. And before that, a patient I know, he should be careful about taking his vaccination and trying to find a proper shoes for himself.
Yes.
I know it's don't wear these slippers, and then I'm sure you will have a foot injury during the pilgrim. There are places in Mecca that actually can walk with shoes, not inside the sahan itself, and the outside the skirt you can keep your shoes on and walk with them.
It's longer distance.
It's a longer distance, but you don't want to be there with barefoot and people stepping in your feet and hitting it.
Yeah, because
and
it can be
the time
disaster for
that you will
them.
spend trying to heal your foot is much longer than the time you will spend walking extra distance.
Okay, that's very nice advices, actually.
And the thing is with also the diabetic during Ramadan is of course the medications. They have some of them have insulin, some of them have oral tablets. So, for example, how can they arrange their medications?
Usually, it is much easier for people to have it twice a day. This is the easiest part. We can imagine that the fasting time is the sleeping time. So he will take his the night tablets at the start of fasting, at suhoor, and he can spend most of the time of Ramadan, the fasting time, sleeping. Well, and it is actually advice even by as a sunnah is to try to take most of the time off by sleeping to relax yourself. The activity then it will be like breakfast, our normal breakfast, then you take your medication at that time. If you experience any hypoglycemia, checking your blood sugar will not affect your fasting. It's just a drop of blood and it not affect. But if you find your blood sugar is low, please don't take risk, break your fasting. And it is by Islam, it is your responsibility to protect your health. This is at the top priority. Everything is below it. Fasting or anything else, your health is very, very important in Islam. And breaking your fasting is very justified if you have a risk in your health.
Is there any specific figures where you would say the patient's going to hypoglycemia? Can you just
amazingly, it's an individual thing. A patient who have a long-standing blood diabetes, he can have the hypoglycemia at levels which are not, by definition, hypoglycemia, like 5 or 6. Okay. But others, they can develop hypoglycemia as a number, like having 2.3 or even point something. I've seen this. Please break your fasting. Take sugars, sweet drinks, anything, even some sugar tablets. You can suck on them. This is serious and should revise your diabetes control with your doctor at that as early as possible, because something happened there.
We're focusing our talk right now really about hypoglycemia and the danger of it. And how about hyperglycemia? Does it really affect the patient?
Okay, hyperglycemia, it's a long-term effect. It will take years for you to develop the effect of it. Now, trying to control it, if you have a short time of hyperglycemia, it's not as bad as people get scared of it. Now, if I keep my blood sugar around 11, that's good. It is high, but it is good under the long term. But I will not go and keep it 20 or 30 for a long. This is dangerous. You know, it's actually, well, I will shorten the time of the chronic problem of diabetes. They will come at earlier time. I'm expecting this to come after 10 years. But if you are not controlling it, it will come after 5 years or so.
How frequent should they test their blood during the fasting?
Yeah, usually I will advise them to check it before breaking their fasting.
Okay.
This is like waking up in the morning.
Okay.
You can check it.
Yeah.
And if you have any symptoms of hypoglycemia, you can check it.
But should they check it without the symptoms? Should they check or no need?
No need.
No need.
No need. Shouldn't be a habit because
shouldn't be obsessed with
yes,
it.
if you don't have the hypoglycemia, you should not go doing that. It is a waste of money and you just breaking your
and it's painful.
Painful and it can cause infection.
There is one question from our viewers. His name is Yusuf. He was asking about how effective is the face mask during Hajj times?
Face mask, okay.
Do they have to put it all the time?
All right, it's a good question. Now, usually in crowdness, using the surgical mask. Surgical mask is easier to wear. You can breathe. Don't try to use the sophisticated N95. It's a torture wearing them. If you have symptoms, you should wear it. If you have cold or runny nose, you should wear it because you don't want to infect others. Others, if they are having poor health, like imagining mainly the people who have lung problem, like asthma, they should consider, if they can't tolerate it, they should wear it. Otherwise, I think it is prudent just to wear it without these two indications.
We would like to thank you so much, Doctor, for being here. It was an interesting topic, and it's absolutely, every diabetic patient should know about these things. So any final advice for the patients?
My final advice that to know that we are the doctors. It is our solemn job to help you, and we cannot do this job without your help. So please don't hesitate in asking your doctors, and please don't have a second thought about taking care of yourself.
Thanks, Dr.
Thank
Ghanem,
you.
for accepting our invitation and for your positive spirits. And I
Thank you.
hope most of the diabetic patient now knows a lot about diabetic foods and how to manage it and what are the symptoms or signs they should check for and
Yeah.
tell
You're
their
welcome.
doctors about it. Thanks again. Hopefully we're going to see you by next week.
Yeah,
Inshallah.
thank you so much.
Thank you.
And we would like to thank the viewers for watching, and we will see you next week with another episode. Thank you so much and have a good night.
Thanks a lot.
Thank you.